Awesome. I see folks are joining us. So give us about a minute or two, and we will get started shortly. Thank you everyone for joining us. I see our numbers going up here. Welcome folks. For those folks who are joining us, feel free to pop into the chat and let us know where you're joining us from. We'd love to get to know who's in the audience today, since we don't get to see your wonderful faces. Awesome, and we'll get started shortly. Again, we'll get started here in about 2 minutes or so. Hang tight. I see a lot of friends in our attendees list, a lot of folks from our clinics. And I know there's some issues with the chat right now, but if folks wanna, if there's any questions that come up, and we're trying to figure out the chat situation, but if there's any questions that come up, there is a Q&A function where folks can just ask their question and we can make sure that the panelists are answering. And so please feel free to use the function, or if you just wanna share something with us as we're getting started, we're happy to review that as well. And we'll give folks another couple of minutes. I see folks are still joining us. Awesome. Again, I see a lot of our community partners or community health centers. Awesome. See our friends from Chidla. Thank you, Daniel. Awesome. And again, we'll get started shortly. Oh, we have a few more folks joining us, actually. Awesome. And Jonathan, are we good to go on the slides, or do we need a couple more minutes?
We probably need like 1 more minute. We should be good.
Okay, we're loading. Great. So I'll get us started since I have to do, I have to introduce myself to the team. My name is Lisette Escobedo. I am the Associate Vice President of Civic Engagement Advocacy at AltaMed. I've been with AltaMed for a little bit over a year now, and I handle all things civic engagement within our organization. It's important to note that although AltaMed is not itself a civic engagement organization, we are a healthcare organization that values the importance of civic engagement and that does this work because we know it will truly impact the health of our communities. And so I wanted to share a little bit about what we're going to be covering today. Today is a really exciting webinar because, as folks know, we just had a primary election this past June, where we learned a lot of things. Many of us ran programs, either get out the vote programs, ran various polls, or just looked at the data to see what the turnout told us about where we need to focus our energies, specifically as it relates to encouraging Latino voters to turn out to vote. And so today we have some amazing speakers who will share data, will search research findings, and we'll share lessons learned from the work that they did this past primary election, because we're just a few months away from the general midterm election, which we know is going to be a huge undertaking, again, because we're going to try to encourage all of our community members to register to vote, to turn out to vote. And so we want to make sure and equip folks with some of the lessons that we've learned, in hopes that it'll prepare folks and propel you all for the work ahead in November. We know that this November election is going to be a massively important one, because we'll not only get to elect folks that are going to represent us in Congress, in the state Senate, state assembly, city councils, county level, right, state constitutional offices in the state of California, but we're also going to get to vote on very important ballot measures that have to do with women's health, with the health of our communities, with education, and many other funding proposals as well for our community. And so making sure that Latinos and communities of color are at the table when it comes to making those decisions, specifically as it relates to voting, is going to be absolutely key. And so again, we hope that we can provide some of those tools today. We have a jam-packed agenda. So the one thing that I'll share is we may not be able to get to everyone's questions today. In the event that we might go a few minutes over, we are recording this webinar and we will be providing the PowerPoint deck to everyone. But if you do have questions, anywhere throughout the presentation, please drop them in the Q&A, so that if we can't answer them during the presentation, someone, hopefully one of our colleagues, will answer them in the actual Q&A chat. Our chat should be working now, hopefully, fingers crossed. And so we do, for folks whose chat is working, please feel free to drop in share a little bit about yourself, your name, what organization you're representing, where you're dialing in from, and that way we can send some shout outs to you all. Great, and we're just waiting for the presentation to load, so just bear with us, folks. Zoom glitches, they never fail. Jonathan, are we ready to go with the presentation? There you go. Awesome. Okay, now we're ready to rock and roll. I think we just need to put into, there you go. Awesome. All right, so I already shared this portion, so let's dive right into the presentation. Next slide, Jonathan. I already provided the welcome. Next slide. Awesome. So many of you might be wondering, why is AltaMed hosting this webinar? And why is AltaMed speaking in this webinar about elections? What's really important for folks to understand is that the background of where we come from as AltaMed and the reasons why we exist has to do with social justice underpinnings, where our work is rooted in the idea that quality healthcare is a basic human right for our communities. And so over 50 years ago, we had what was known as El Barrio Free Clinic, where we were providing healthcare services to underserved Latino communities. This was during the time of the Brown Berets, of the walkouts, the civil rights movement. And because we saw that there was a huge need in our community, but there wasn't access to services or access to the type of healthcare that was needed, access to providers as well. And so we established ourselves as a storefront Barrio Free Clinic where we were providing these services. Fast forward 50 years later, now we are AltaMed Health Services with over 3,500 employees and serving over 300,000 patients. But the essence of why we exist in terms of providing healthcare to those who are in need and making sure that they have the power to make key decisions on their healthcare is still part of the mission and the vision of the work that we do. Next slide. And so why is voting important or civic engagement important for AltaMed? We know that when patients come into our clinics, we can provide them medicine, we can provide them medical care, all things that can tackle about 10 to 20% of their healthcare, right? All of those, all of the preventative and the medication, and really seeing folks at our clinics and seeing how we can assist them at the moment. However, we know that 80 to 90% of what makes our community sick have to do with environmental conditions in our community. And how do we change those environmental conditions? How do we change this idea of minimizing exposure to carcinogens, to pollution, having access to healthy water, having access to green spaces, healthy foods, and then being able to have certain healthcare programs that are funded to serve the most underserved? It's by building power. It's by making sure that we're at the table when decisions around healthcare are made, that decisions around where to place chromium plants and warehouses are made, freeways. And so we can only do that by establishing the infrastructure by which this power is decided, which means electing folks into office, voting on key ballot measures, and continuing to build power through the civic engagement process, participating in the census every 10 years and redistricting. And so civic engagement is a vital concept to the continuum of care for our patients. And why are community health centers important? Because we serve one out of 5 Californians is served by one of the community health centers in the state. That's about 7.4 million patients. Nationwide, community health centers serve about 29 million patients. And so when we talk about the most underserved and who need the information and the services, it's the communities that we serve. Next slide. And so this is just kind of a visual of why civic engagement is important to us. If you take a look at where our AltaMed clinics are located, and you overlay that with where low propensity voters are located and where some of the hardest to count census tracts are located, we are in those same areas, which means that clearly there is a lack of investment, a lack of infrastructure, and at times a lack of services in the communities that have amongst the lowest civic participation rates. And so when we serve those communities, we serve them around their healthcare, but we also want to make sure that they have the tools to empower them to do something about these lack of services or lack of access, because we are located at the epicenter of all of these social determinants of health, and again, of low participation rates. Next slide. And so that's why we do this work. Again, we're going to talk a little bit about how we do this work as well. But I wanted to just share some of the work that our partners have done and really share some important information to equip you all, again, as you prepare for the general election. And so today we have a distinguished group of speakers who are also great friends of the organization and who are really vital for us to be able to accomplish a lot of what we do. We have Dr. Mindy Romero, founder and director of the USC Center for Inclusive Democracy, that's going to talk to us a little bit about the data around the primary election turnout. We have Dr. Francisco Hasso, who's a research associate at the Pat Brown Institute for Public Affairs at Cal State LA, who did a lot of research work and a lot of polls specifically around LA County this past election. We have my colleague, Robert Blackman, who is our civic engagement data analyst here at AltaMed, who's going to talk a little bit about some voter engagement experiments that we ran and what we learned. We have our friend, great friend, Vanessa Aramayo, who is executive director at Alliance for a Better Community, who also who led the SELA Votes effort, which was an amazing effort to get the Southeast LA communities out and voting. And then we have our great friend and my former colleague, Eli Flores, who's executive director for Orange County Communities Organized for Responsible Development, also known as OCCORD, who partnered with us on running an amazing campaign in Orange County to get out the Latino vote this last primary election, but who also has done, as the organization itself has done quite a bit of work in building Latino power in OC specifically. Next slide. So with that, I'm going to go ahead and hand it over to Dr. Mindy Romero to take us to what we learned from the data this past primary election.
Thanks very much. I'm just going to go ahead and jump in because I know we started a little late. Thank you. Perfect. So yeah, I'm going to go ahead and give an overview of the state of the Latino vote when it comes to primary elections, and specifically some information also on the most recent primary election. back in June. So the talk of my talk summary, the things that I'm going to cover are those current voter numbers that I just mentioned. I'm also going to talk though about the history of the Latino vote in primary elections in LA County, and then talk about what it all means, which is ultimately the level of Latino representation. Next slide, please. Next, there we go, thanks. Okay, so just talking right now, first, before we can talk about voting, we need to talk about registration because of course it's a two-step process in our country. You have to register before you can vote, and there are significant disparities when it comes to registration rates in the US, in California, and in LA County, particularly when we were talking about the Latino community. So the first set of numbers I have up there are just showing you roughly a few months old, our current registration rates in California overall for everyone, and that's 81.5%. And when I say registration rate, let me define that. I mean the percent of those that are eligible to register to vote that actually got registered, that are actually currently registered, whether they vote or not, that they're actually registered. So within the Latino community statewide, we have about 8.2 million Latinos that are eligible, so adult citizens, to vote. The number currently registered is roughly about 6 million, and the registration rate is 72.6%. So for everyone in California, all groups, 81%, for Latino, 72%. And consistently, even with recent advents of recent reforms such as automatic voter registration, we see Latinos consistently about 10 percentage points or so. That fluctuates a little bit over the years in terms of their registration rates being lower, so about 10 percentage points or so lower than the general rate. In LA County, the general rate is higher, it's 84% registration for everyone. There are about 2.6 million currently eligible Latino voters, adult citizens. Registered just under 2 million, and that registration rate for specifically the Latino community in LA County is 74%. So 84% for everyone in LA County, 74% for Latinos. And 33% of all of LA's registered voters are Latino. Next slide. So now we're going to talk about turnout. So there's two ways typically that we measure turnout that you'll hear people talk about when they talk about turnout. And it's really important to know which one they're talking about. So if you're not familiar, I'm just going to run through total registered voter turnout. Now that's defined as the percent of those who are registered to vote that actually turned out and cast a ballot. So registered voter turnout in the primary from the Secretary of State's official numbers, 28.9% was the total for LA County registered voter turnout. That put LA County at 49th out of 58 counties in terms of their ranking with their registered voter turnout. Now, eligible voter turnout is that second way to measure. So that's the percent of those that are eligible to vote, right? Adult citizens, whether they're registered or not. And you can see there that for the state, it's 24%, overall 47th. For the state. For eligible voter turnout for LA County, for everyone in LA County, 24%, that put LA County at 47th out of 58. But if we look specifically at the Latino community, and these are preliminary numbers, we still have to do our detailed analysis at my research center. But registered voter turnout in LA County, for Latinos specifically, 18.6%. And then for eligible voter turnout, again, for Latinos specifically, in LA County, 13.9%, and there's the rankings there. But because of those disparities in registration rate that I just mentioned a little while ago, we highly recommend wherever possible that the analysis, the discussion should be looking at eligible voter turnout rate, because registered voter turnout rate, you lose a lot of that disparity that is present for the Latino community and other groups. So you want to look at eligible voter turnout whenever possible, because your denominator, right, is again, everybody that's eligible, and you get a sense of representation and power. Next slide, please. Latino vote history in primary elections, next slide. So I just gave you some preliminary numbers for 2022's primary. Next slide, please. Now we're gonna look at eligible voter turnout, again, the percent of those who are eligible, adult citizens to vote, LA County, and we're going back in history. So this is 2010 to 2020. Now, if we had more time, we could really dive into all of these numbers. I don't want you to get stuck on any of the individual numbers. What I just want to show is that gap between Latino and general turnout is always present, right? I'm not surprising anybody here on this webinar, but I want you to see that over time, whether we're looking at 2020, which is on the far right, which was a historically high, not a record, but historically high turnout in California, or we're looking at 2018, which was a high midterm. Of course, right now we're in a midterm election cycle, midterm to midterm. Whatever we're looking at, we are looking still at disparities, right? So blue is Latino, so that's the Latino eligible voter turnout rate. Red, just for our purposes today, we're just going to say we're looking at everybody who's not Latino, so the non-Latino turnout rate. So Latino compared to non-Latino, you can see a significant gap over time. Now, we know that many of you that are on the call, many groups have made tremendous progress, have done so much around mobilizing the Latino vote, especially neighborhood by neighborhood within LA County. So this is not to say that work wasn't impactful. Of course it was. And we are seeing Latinos having a growing voice in many different ways, depending on how we measure it, right, within LA County. But when we come to turnout, we still see, right, disparities that are entrenched over time and currently. And it's important to note that, so we know, again, kind of the state of turnout, where, accurate picture in terms of goals and mobilization efforts and targeting and that sort of thing. Next slide. And this is just to compare primary versus general. So you saw the numbers were much lower when I showed you primary history. Now this is general history, right? Much higher, but disparity still present. Next slide. This slide now is just showing you the difference between Latino eligible voter turnout and non-Latino eligible voter turnout in primary. So we're just actually looking at the difference. So from 2010 and 11.7 percentage points was the difference between those two groups, to 2020, 17.8. So I just wanted to show you here the difference over time between those two groups. Next slide, I'm showing you general elections, and you'll see even larger percentage points difference here when we're looking at general elections. Okay, again, but we're going to move on. Next slide because of time. Next slide, please. Latino representation. Okay, go back for just a second, if you don't mind. Let me just describe this here. So when we're talking about representation, we can mean a lot of different things. Here, I'm talking about numeric representation at the ballot box. So a group, any group, is represented amongst voters if their share, numerically represented, if their share of those casting a ballot in that election, whatever election it is about equal to their share of the eligible voter population, adult citizens. So if a group is 20% of the eligible voter population, they should be about 20% of the voting, actually casting a ballot in that election to be numerically represented, right? You might want to go higher and be overrepresented, but at least to be represented, right, numerically, equally, it should be about the same. Next slide, please. For Latinos, because there are disparities in turnout rates, that leads to Latinos being underrepresented amongst those casting a ballot. So here again, just 2010 to 2020, just quickly, the blue is the Latino share of the eligible voter population or adult citizens, as I mentioned. So in 2020, 40.8% in LA County, right? Latinos were 40%, almost 41% of the adult citizen eligible voter population, right? Power there completely. But because of disparities in turnout rates, Latinos were 27% of actual voters casting a ballot in 2020. Still power, right? That's been increasing through the years, but not numerically represented. So still a gap right there to be filled in terms of representation. Next slide, please. And this just shows you general elections as well. Over time, whether we're talking about primary or general, I don't want you to get bogged down in the exact numbers. We still see, underrepresentation. Next slide, please. Reasons for lower turnout. So I don't have time, but I wanted you just to have this slide. Next slide. This just gives you a sense of some of the reasons for lower turnout. So clearly there are historic, current dynamics that are at play in our electoral system that disadvantages Latinos. It makes it harder for Latinos to participate. This isn't a story of Latinos just don't want to vote. Of course not. Many Latinos participate. Many Latinos have a voice, a powerful voice at the ballot box. And for those that aren't, there are real forces at play for why that's the case. So I just wanted to put that slide there, even though we don't have time. Next slide. And then on my website, we have a lot of research available for Latino turnout period in the state, but also in LA County. Just to let you know, you can go to our website at cid.usc.edu. Next slide. And now just really quickly, I want to leave you as you all talk in the future about how to strategize, how to mobilize, how to change some of those numbers, how to increase Latino representation at the ballot box. Next slide. I just want to talk really quickly about the change over time in the use of vote by mail. So across the state, we've seen significant growth in the use of vote by mail. In this last primary in June, 91% of all ballots cast were vote by mail ballots. But it's really important to note that Latinos tend to use in-person in higher numbers than other groups. Everybody, including Latinos, are using vote by mail in really high numbers, but Latinos are more likely than other groups to go to an in-person location. And when they use vote by mail, right, our community is still dropping those off or dropping it off at a staff location, not just by mail. Next slide, please. Next slide, please. Okay, so next slide, because I just said this. We've got 2 slides left. So this is just to say that in LA County in the 2020 general election, that's the most recent data we have, 22% of all Latinos who actually voted, cast their ballot, did so in person, right? Where Latinos statewide were 15.9%. So more Latinos, higher percentage, are voting in person in LA versus the rest of the state. Another 15.6% of all LA County Latino voters dropped off their VBM ballot at a staffed vote center, not just a drop box, not through the mail, but a staffed vote center. And we know through our research that there are lots of real reasons why many Latinos chose to go to a staffed vote center as opposed to a standalone drop box, sometimes to ask questions, those sorts of things. And that meant that 38% of all Latino voters, those actually voting in the 2020 general election, used a vote center to either vote in person at a machine or to drop off their ballot. Next slide, and that should be my last slide. And this is just visualizing what I told you for time. I'm going to skip that and say thank you very much. Next, there you go. Thanks so much. And I'm turning it over to Lizette.
Thank you so much, Dr. Mindy Romero. Always amazing information. Again, just to remind folks, we are going to give you a copy of the slide deck and also the recording. So if you didn't, don't feel like you need to take a picture of the screen or anything like that, you all will be provided with that. But again, thank you so much, Dr. Romero, for this amazing information. With that, I wanted to hand it over to Dr. Francisco Hasso, who again is a research associate at the Pat Brown Institute for Public Affairs at Cal State LA, who's going to share a little bit about some of their research findings and how these can be useful, again, as we prepare for the general election. I'll hand it over to you, Dr. Hasso.
Thank you. Good morning, everyone. I hope everyone is doing well. My name is Francisco, and I'm the research associate at the Pat Brown Institute for Public Affairs. I'll be presenting 4 key findings and takeaways from a survey we conducted in collaboration with the California Community Fund in November and December of 2021 of 1,500 Latino residents from LA County. Our survey asked a variety of questions, but I'll be sharing the most relevant to our panel discussion today on the lessons learned engaging Latinos in LA County. Next slide, please. The first key point I would like to share provides a foundation for the following points I will mention and has to do with civic engagement. We asked Latinos in LA County if they had been able to engage in certain civic activities in the past 2 years. As you can see, only about 13 to 18% of Latinos in LA reported communicating with an elected official, attending a public meeting, donating to a campaign, or protesting. However, political engagement increases, in some cases doubles to 28% when the activities hit closer to home, such as attending PTA meetings or volunteering at their children's school. So the takeaway from this first set of data is that Latinos in LA are more likely to engage in political activities where they could see the impact from their participation much more clearly. This may not be groundbreaking, but it does indicate on which activities Latinos are spending their energy. Next slide, please. Our second key point has to do with the impact of voter outreach. We asked our Latino respondents if voter outreach might motivate them to vote. As you can see on the left-hand side, 59% said it would motivate them to vote. However, when we asked if anyone from a campaign, political party, or community organization had reached out to them with information to register to vote or encouragement to go vote, fewer than a third of Latinos, 31%, in LA County said they had been contacted. Next slide. What is more insightful about this data is that we found a gap in reported outreach when we looked at the nativity and age of our Latino respondents. Latinos younger than 24 years, the 35% bar that you see on the far left, were more likely to report contact than Latinos older than 60. This is the 21% bar in the first graph on the far right. Similarly, 37% of US-born Latinos said they had been contacted, compared to 23% of foreign-born Latinos on the right side of the slide. We could also focus on the orange bars for those that said they had not been contacted, and you'll get the same story. So the takeaway from our findings that few Latinos report being reached out to, and that some within the Latino community report even less outreach. Well, we know that political campaigns maximize their limited resources by reaching out to high propensity voters, but this is clearly coming at the expense of a majority in the Latino community, particularly foreign-born and older Latinos, both of whom would benefit the most from voter outreach, especially if that outreach is in languages other than English, such as Spanish. Next slide, please. Our third key point has to do with the impact of co-ethnic recruiters. Now, I don't have a graph for this point that I'm about to mention, but fewer than a half, 46% of Latinos in LA said it was very important that a co-ethnic member represent them in public office. But does that importance that Latinos attach to co-ethnic representation translate over to voter outreach by co-ethnics? Would it matter or make a difference if the person reaching out to you shares your ethnic background? Our survey found that the Latino community is divided on whether having a co-ethnic member reach out to them would make them more inclined to listen and consider voting. Fewer than a half, 41%, said it would, while the majority, 59%, said it would not. Adding these findings to the previous key points, specifically the 59% earlier that said would be motivated to vote if someone reached out, our takeaway is that while a large share of Latinos would benefit from electoral outreach from someone that shares their ethnic and perhaps linguistic background, it's enough for the majority of Latinos to simply have someone reach out to them with encouragement and information to vote. Latinos just want someone to connect them to the electoral process and remind them that their vote matters. Next slide, please. Our fourth and final key point has to do with trusted messengers. Latinos in LA were asked how much they trusted a variety of sources to be responsive to their needs, ranging from government, healthcare professionals, teachers and school staff, community organizations, and the media. We found that fewer than half, 44%, this is the bar on the very far left, 44% of Latinos said they trust the government to be responsive just about always or most of the time. Now, 44% is a large share, but the two most trusted sources you'll find towards the middle. Healthcare professionals are at 79% that say just about always or most of the time they trust them to be responsive to their needs, followed by teachers and school staff at 67%. So when reaching out to Latinos in LA and motivating them to participate in our electoral process, the messengers most likely to have a positive influence seem to be non-governmental. In the case of our data, these trusted messengers are doctors, medical professionals, educators, and any organizations connected to them, such as the one hosting this webinar. And with that, I'll turn it over to Lizette.
Thank you so much, Dr. Hustle. That is a great segue into the next portion of our agenda, where we're actually going to talk a little bit about the work that we did. As folks heard, over 79% of respondents to this poll in LA County cited doctors, nurses, and healthcare professionals as their trusted messengers. And so that's why the work that we do is even more important, right, moving forward. And so I'm going to share a little bit about the work that we achieved this last primary election, just to share some of the model and to give folks, especially our community health centers who are on with us today, some ideas on what you can do to get involved to encourage folks to participate. Next slide. So I'm going to try to kind of breeze through these because I know our time is limited. And for those of you who have joined webinars in the past, know that we've talked extensively about the model in which we do our work, but how we look at our community health centers and the surrounding communities is we try to engage both patients within our clinics. We try to engage our staff in the civic engagement process, because an important note for AltaMed staff is that over 70% of the staff that work in our community health centers actually come from the communities that we serve. So when we engage our patients, we engage community as well. And so again, with our inpatient, we do lots of work to make sure that our patients are receiving information as they're waiting for their appointment in the lobby area, as they're engaging with the front desk, they're engaging with the videos that are in our waiting areas. And the idea is that when you go to AltaMed, you'll be exposed to some sort of information around the upcoming election or any upcoming civic engagement work that's going on. Next slide. And then, as I mentioned, we also engage our staff. We engage them through, I actually have staff swag on right now, which is our My Vote, My Health shirts. We provide those to front office staff, to clinic administration. We also engage our various departments, our workforce development department. We really do a mapping of what are the opportunities where we have to engage our staff in this work. We present civic engagement in our new hire orientation. We embed civic engagement into our family residency program, those folks who are, who are medical students who are engaging with us. And we engage our providers. We have some of our provider champions actually on the call at the moment. And so again, we look at the staff to an additional component and a key champion component to our community. Next slide. And then the last layer of our work is we look at a specific mile radius, usually a 5-mile radius around our community health centers, and look at how do we engage the communities that our patients go back into in the civic engagement process. So we actually run traditional voter engagement operations out of our offices and through our civic engagement team. Where we do phones, we do texting, we do doors, but we really have a high emphasis on those areas around our clinics. And my colleague, Robert Blackman, is going to talk a little bit about what we learned from those efforts of concentrating our door-to-door and our get out the vote efforts within high patient density areas. But we also do, we do ad buys, we do streaming, and really the messaging is what sets us apart for a lot of the kind of mass engagement work, which is really focused on voting for your health. Because we know that, again, the social determinants of health can be determined by who we elect and who we elect into office, who is in power, and the measures we vote on every election. Next slide. So what we achieved this last primary election, it was a huge endeavor for us, but a very exciting one where we learned quite a bit. My colleague's going to talk about our voter outreach efforts, so I'll kind of skip that. But in addition to doing get out the vote operations, we actually also hosted 17 voting locations at our AltaMed clinics, the majority in LA County, where we partnered with the Registrar of Voters, both in LA County and Orange County, to host these voting locations. These were ballot drop-off sites, these were pop-up sites, and these were vote centers, flex vote centers. And through those sites, over 611 ballots were casted. We had a particular successful engagement at our PACE sites, which are sites where a lot of our elderly communities goes to get services, to do activities. For them, it was about accessibility. So you'll see here on the left that we actually had one of our patients who voted for the very first time at one of our PACE locations, and we had many stories like hers. In terms of our in-clinic outreach, again, we map out what are all the opportunities to engage with the patients and with staff. Some of those opportunities that sometimes that get bypassed but are actually amazing ones are, for example, in-network screensavers, where we all have the same screensavers, load them through the network, and it has information on elections. We got 152 million impressions through our screensaver work. We also hosted an LA mayoral town hall with some of the candidates for the LA mayoral race. We did this in partnership with our friends at Intravisión. And we recorded these kind of 20-second snippets where they answered a question that came from one of our doctors around social determinants of health. And when we circulated the answer to those questions in all of our clinics throughout LA County, so that as I was waiting for my appointment, as I was waiting for my medicine, I was actually able to listen to the candidates and where they sit on issues that were important to healthcare. And in addition to that, we actually ran these 20-second snippets as radio ads as well with Piolín, Erasmo y la Chocolata. And so the idea is when I'm at AltaMed, I can learn about these candidates. When I get in my car, turn on the radio, I can continue to learn about the candidates in the ballot. And really our model within our AltaMed facilities is I can go to AltaMed to get my healthcare services, but I can also get information on the election or on civic engagement. And at the same time, I can register because we have voter registration forms available, and I can vote at my local clinic. And so this is a model by which we follow, again, huge successes, tons of impressions, and really tracking our work and tracking where our effectiveness has been the key to the success of the work that we do. Next slide. Great, and with that, I'm gonna hand it over to my colleague, Robert Blackman, who's gonna take us a little bit more into in-depth around what we learned with the voter engagement work that we did in terms of where our highest success rates. So Robert, I'll hand it over to you.
Great, thank you, Lizette. Thank you everyone for being here today. I've been with AltaMed for about 3 years, and the work that we did in the 2020 primary was really the first time we were able to do the work in a really trackable and knowable manner. So I'm really excited to share the results with you. So next slide. All in all, with our partners in LA and Orange County, we were able to attempt to contact 209,328 voters. And when all the numbers came back, we had a successful contact rate of 15,356 unique voters. Next slide. Oh, turn on my camera. Oh. I'm reading from my WebEx messages. Sorry about that. Okay, so one of the things that we've been attempting to understand since the 2018 cycle is what effect does our My Vote, My Health campaign contacting voters multiple times in the cycles, the election and the census cycles since 2018. And as we work in sort of we do our work in three primary areas, Southeast Los Angeles, East LA and Boyle Heights, and Santa Ana and Orange County. I was glad to know that for the voters that we have contacted 2 or 3 times in cycles and census since 2018, we have seen participation rates that are higher than the averages for these areas. And so especially when we get to the point of talking with voters that we have contacted 3 previous times, we see a pretty significant lift in their participation over the average in those geographies. Next slide. And one of the kind of the dual mandates for the work that we do inside AltaMed is figuring out ways to speak to our patients, both in the clinic and out in the neighborhoods where they live. So we did do a focused, a canvassing and phone focus in the 90022 zip code in East LA, which is a area that we know has 20% of the total registered voters are also likely to be AltaMed patients. So the results from that were of the patients of the voters we were able to contact in this area, nearly 19% of them actually are AltaMed patients on a match back. And these folks participated at 17.6% when we were able to contact them twice, and 17% for the single contact of a canvas, versus the 15.9% for Latino voters overall in that zip code. Next slide. And then we were asked to do work in areas where AltaMed does not have a significant presence. Actually, we don't have physical locations within either of these boundaries, but we were asked to reach out to voters in them as to try to get a little bit of a lift in the mayoral primary. And so in Highland Park, We did see a 0.62% increase for voters that we contacted in that area versus the average for Highland Park, and in Lincoln Heights, 0.54% increase. And it'd be nice that people remember that it was AltaMed that contacted them in case we do open a location there. And next slide. And then the last little look that we wanted to take was multi-tactic contacts. So these are voters in this cycle who were contacted via more than one method, canvassing and texting. In LA and Orange counties, we do see a lift. Phone and text, not as significant, but at least not nothing. And then phone and canvas seem to have the best results overall for both Los Angeles and Orange counties. And I apologize for the not setting up that final pink box there correctly. Anyway, that's all I have. So thank you, and back to you, Lizette.
Awesome. Thanks so much, Robert. And so now we want to share some of the work that we're going to be doing ahead at AltaMed, and you know, some of our partners will be sharing some of the work that they'll be doing as well. So there's going to be plenty of opportunities to engage with our work moving forward. Next slide. So just a couple of key dates. Again, don't worry about writing these down. We're going to send you this deck. There's a lot of key dates here that we want to make sure that you write into your calendars, especially as it relates to early voting, voter registration dates. As you plan your activities for the general election, it's really important that you think through what are some opportunities for press conferences, for activations, et cetera, around these key dates. This is how we're thinking about the work, specifically as some of our sites, our voting sites begin to open. Next slide. So we're going to be engaging about 272,000 low propensity voters, both in LA County and Orange County. We shared that we did 200,000 was our goal for the primary election, and we did 209,000. We're kind of upping the game a little bit and doing 272. Out of those 272,000 low propensity voters, we're going to have a huge emphasis on Latina voters, as you see on this slide, specifically because women's health and Latinas' health, right, is going to be on the ballot this election. And so we wanted to test out really this idea that Latinas inspire others in their household to turn out to vote. And so we're going to do a huge oversample of our voter universe this time around, focusing on Latina voters. 10% of our canvassing is going to be door-to-door canvassing. 30% of our canvassing efforts will be through phones. 60% will be through peer-to-peer texting. And so as Robert shared, we're going to be again looking at the multi-tactics and how this all kind of works out. But we're very, very excited for our Latina Vote Initiative, which I'll share a little bit more about. Next slide. So again, we're focusing on Latina voters. We're doing a couple of things. One, I shared about the oversampling in our canvassing work. We will also be doing a specific mailer to Latina voters within a certain mile radius of all of the vote centers that we'll be hosting at our women's health services locations. So we're actually going to be activating 4 clinics where we have women's health services, and we're going to have very specific material and pamphlets that are catered to a lot of our patients there that focus on the importance of voting for their health. Again, because it's on the ballot this election, because we've heard, right, all of the kind of the debate around that and everything that's been going on. We're not telling them how to vote on any specific measure or anything like that. We're just reminding them that their vote is very powerful. Not only is their health on the ballot, but also, as folks may know, Latinas actually vote at a higher rate than Latino men. And so when we talk about the matriarchs of the household and who can really inspire folks in the household to turn out their vote, it's Latina women. So this is what we're going to be focusing on and doing experiments around coming up in this upcoming general election. Next slide. Great. And then we're going to be hosting about 14 voting locations. Here they are. Again, don't feel the need to write them down. I'm sure we're going to give you all a copy, but we're going to be hosting these all throughout LA County with an emphasis in Southeast LA and a lot of our East LA, Boyle Heights, and Commerce area as well. In Orange County, we'll have a pop-up mobile site. Next slide. Great. So with that, and I know, Jonathan, you have to do a reshare, but while you do the reshare, I'm going to hand it over at this point, and we're going to do a reshare of the PowerPoint to our friends at Alliance for Better Communities, who again, I mentioned, hosted or led the SELA Votes initiative in Southeast LA. And so they're going to share a little bit about some of the lessons that they learned through this work. And we're really excited to for them to share some of their findings as well. So with that, I will hand it over to my colleague, Vanessa Aramayo, who's the Executive Director at ABC.
Thank you, Lizette. It's such a pleasure to be here with all of you. I know that we're running short on time, so I'm going to go really quickly through the slides, and they will be available to you later. So good morning. My name is Vanessa Aramayo. I am the Executive Director at Alliance for Better Community, also known as ABC. ABC is a nonprofit organization that advocates for social, economic, racial equity, and justice for the Latino community throughout Los Angeles. And we do this through power building and policy advocacy. Next slide. I think we're on the wrong side. SELA Votes, it's slide number 2. So SELA Votes, we were proud to launch this program for the primary in June. It was a program that worked with partners to focus on one objective, which is how we are growing electoral power in Southeast Los Angeles. I'm going to talk really briefly about how we landed and why ABC is doing this work. Next slide. Last year, through ABC's work, actually really in voter engagement stems from a policy roadmap that we released last year. And this policy roadmap was really making the case for why it's critically important to prioritize voter outreach in key majority Latina regions. I won't go too much into this. You've heard some data earlier from Drs. Hasso and Dr. Romero, but it's all to really emphasize the fact that the data all shows that Latinos are a significant majority in Los Angeles County, and it matters that the representation is done at the ballot box and that their voices are exercised during elections. Next slide. You've already heard some of the data. Again, Latinos are the largest population in Los Angeles. They compose nearly half of all residents. Undoubtedly, every election season is crucial, but in Los Angeles, where almost half of the population is Latino, Latina, the needs and the voices of our community must be lifted with every election. Next slide. This is why ABC developed the SELA Votes project to strengthen voter power in SELA. In SELA, 98% of the population is Latino, Latina. And I understand many of the AltaMed staff that work at the local SELA clinics are also residents of SELA, which is so phenomenal. Next slide. So what was this program? This program was really an initiative to build the necessary infrastructure to increase voter turnout. You've heard about the voters that are registered, those that are eligible but are not registered, and the need to increase this turnout and voters to come out by election day. In order to do this, we really need to look at the key strategies to how this can get accomplished. And so for the SELA Votes initiative, we looked at how we were creating a coalition of local Southeast LA serving groups. We looked at how we were increasing the capacity of community-based organizations that were specifically going to work on this, do this electoral work. And we also looked at securing long-term necessary investments to be able to complete it, not just for the June primary and for the general election in November, but really how we're planning for these efforts and how we're securing these investments in the long term so we can essentially and eventually have an impact in the 2024 presidential and really continue to grow from there. This is also done through another strategy of being able to grow a base of informed voters that are contacted in a peer-to-peer format. You heard earlier today about trusted messengers. There are no better trusted messengers than your neighbors, your local community members. In schools, it's educators. In the health clinics, it's your physicians. It's people that are in the healthcare industry that are able to pass on a message. So this first primary in June, this was the first coordinated effort that we were able to launch. And the partners that you see, the logos that you see on this slide include 4 partners that did the canvassing, whether it was door knocking or texting, and they were COFEM, the Consejo de Federaciones Mexicanas, Innovate Public Schools, East Yard, and ABC. Our partnership with AltaMed and SELA Collaborative were also very key to ensuring the success, and we were able to really leverage resources from the 2 partners to be able to do this. Next slide. So the SELA Votes program was a program that engaged local residents and engaged members or clients of our partners. We had a very short window to create the program, and that was due to a challenge that I will talk a little bit more about. I'll touch a little bit about in a few minutes, but we had 40 canvassers that walked nearly 120 shifts and logged in over 1,600 hours. Next slide. This Promotoras program really was able to get launched quickly because the organizations already have a presence in these communities, and those promotoras that they engaged were promotoras that have either went from not having any experience working on an electoral effort to having experience working on previous campaigns, but essentially the common denominator was everyone had played a leadership role by either having a training in advocacy or a training on a particular issue, whether it was immigration, health, or environmental justice. These were community residents and promotoras that were already engaged in through the local organizations. Next slide. We had a social media component as well as a traditional media component. The next slide has to do with that traditional media. Some of the lessons that we learned that I'll dive into, I can dive into at another point, and I'm happy to leave my contact information, was how we were able to ensure that our promotoras and our community leaders were trained in a manner that was culturally relevant, in a manner that was accessible through the technology, and in a manner that was using the best technology and the best platforms that were out there in order for the program to be effective and the data to be collected and then analyzed later. Next slide. Next slide. So the 4 organizations that I mentioned earlier created a planning committee, and in this planning committee, there were strategic targeted cities that were identified where there was overlap. These were the 4 areas in the number of registered voters that were chosen because either the organizations already had a strong presence in the region, or there were issues that were on the horizon in these areas that the organizations were working on, and also because there was an overlap with the upcoming elections of Congressional District 40 and Assembly District 58. And just one point of clarification for those of you that might be wondering, nonprofits can engage in electoral work, but they cannot talk, they simply just cannot touch on whether or not to vote for candidates. So the message that our SELA Votes project and our initiative was leading was really on information on when to, the upcoming election, when to vote, how to vote, and where to register to vote. Next slide. Our effort was able to deliver over 10,000 door knocks, contact over 2,500 voters, and identify over 2,200 voters that we talked to that said they would go out and vote. This is an over 90% positive response rate, which is extraordinarily high. This sent us a message or delivered a message to us that really what's needed is for voters to be contacted. Additional data needs to come out on how many of those voters that we actually contacted turned into votes, because some people can say they're going to vote and then actually not vote, or there's a challenge or an issue, but just the mere fact that people were receptive and open and wanting to go out and vote was very encouraging. Additional lessons learned, and I know I need to wrap up. There was definitely an opportunity to increase our presence. Next slide, please. To increase our presence in social and traditional media. It was very important to push important dates, when and where to vote, early voting, being able to share with people that they could do same-day voter registration. The LA County Registrar's Office has made a number of extremely helpful reforms to make voting easier, but we have to remember, and this has been over the course of many, many years, but we have to remember that not all the information has reached our community yet. So it's very important to continue to put out the information about how people can vote. In closing, I just want to say there's a few more lessons. They're included in the deck, and that's going to be shared. Before I pass it over to Lisette, I just want to say some closing thoughts are really that partners like AltaMed that are engaging in this way and putting information out in front of their patients is extremely motivating and encouraging for partners like our organizations, because it's really adding another key trusted messenger in the dialogue to be able to engage our communities in having a voice and eventually passing reforms that are more beneficial to community. Thank you for having us, and I'm sorry if I took a couple more minutes than I was supposed to.
No worries. Thank you so much, Vanessa. That was really insightful. Again, such a pleasure to work with you all to get out the vote in SELA. And so with that, I know, Jonathan, you need to do a share of the slides, but I did want to hand it over to our colleagues at OCCORD, who we partnered with to do our GeoTV efforts in Orange County. You know, LA County, we know is very different than Orange County. And so the efforts, the lessons learned and all of that might be very similar, but also slightly different. And so I'll hand it over to my colleague, Eli Flores, who's the executive director for OCCORD.
Hi, thank you, Lisette. So my name is Eli Flores. I'm executive director at OCCORD, Orange County Communities Organized for Responsible Development. So I'm very excited to be here and to share this with you all today. Yes, Orange County is quite different, but one of the things that we've noticed, or I've noticed in my time there, is that Latino communities in particular, when engaged, will engage, right? And so I think that's a huge lesson for us all. And I think we've all sort of have said this, but when we engage Latino communities in elections, when we take the time to talk to them about the elections, they will engage with us and they will actually turn out to vote. So I'm going to share a few of our lessons learned. So next slide. So Orange County, right, our mission is simple, is to build the power of historically marginalized communities in Orange County. And so for us, what does that look like? That looks like community organizing, policy and research as part of our strategies to build the leadership and the collective voice of our Latino communities and communities and other marginalized communities in Orange County. Ultimately, we are pursuing a lot of the policy changes that really move Orange County to becoming an inclusive economy, a place where education is community driven, and a place where government is responsive to the community and the needs of the community. Next slide. So, you know, I think folks already spoke about what we did in terms of the primary strategy, but for us, right, we focused on the Spanish-speaking population in Santana and in Anaheim. And so, and because we've had historically reached people there in those communities, right, we hired young people from those communities that we targeted. So we made sure that we wanted folks that knew the neighborhoods, that knew the blocks, that knew the people that lived there, to be the ones to actually do the work on the GLTV front. We also did a candidate forum for the Orange County District Attorney's race, which was, you know, sort of like for us to be able to try some of the strategies on education, in particular, bringing the candidates directly to the community. We did a lot of voter education. In particular, we did some how-to videos and election information on social media. So how to fill out your ballot, how to do your vote by mail, how to actually mail it out, like all of that information. We did some pretty awesome how-to videos. And then lastly, our door-to-door GeoTV campaign, including a phone bank to be able to support that door-to-door. And so the lessons learned that I'll share is actually the lessons from the canvassers themselves. We did meet with them right after that. We wanted to learn what happened on the ground, what happened in the field, and yeah, so I'll share those lessons. So next slide. So I'll start with the phone bank side. On the phone bank side, right, canvassers sort of shared that there's still a high number of faulty phone numbers, right? I know that in the past, if you've ever done campaign work, this is a big struggle, but that is still the case currently now. And one of the things that they began to do is that they began to modify and personalize the scripts. So when they sound robotic, they noticed that people hung up on them faster. When they sound like any other telemarketer or any other company or campaign calling them. So what they started doing is just simply engaging them in a very personal conversation first, and then going into the information on the election that they wanted to convey. And the last lesson learned was we need to make sure that technology works. There was a lot of drop calls. Our technology was having some issues. And so I think we just got to make sure on the front end that if we're going to engage in phone banking, that our technology is down, that we try it, that we test it to make sure that there was not a lot of drop calls. Some calls actually dropped in the middle of conversations. So we want to make sure that that doesn't happen in the midterms elections. Next slide. Lessons learned from the door-to-door, canvassers that also shared with us that there is a higher engagement, or at least they engage more folks at a higher rate on weekday afternoons. They did weekday afternoons, they did weekends, and they said that weekday afternoons tended to be the times where most folks were home, most folks are still willing to engage, talk to them. And so they found it a lot easier. They found better conversations. They were able to convey the information. Number two was similar to the phone banking side. It was important for them to be personable and connect with the voter before going into the election information. And this is really like organizing one-on-one, right? You get the opportunity to build that relationship and build that connection. So then you can convey whatever information you want to convey to them. And so our canvassers noticed that. So a lot of the initial like 1 minute, 2 minute conversation was really about connecting with them and connecting with them of how the young people or the canvassers were from the community. And so that was a great connection piece for our canvassers. Lastly, a lot of the folks that they engage actually asked for election information, and we weren't prepared. We did not have any voter guides. We didn't think about having voter guides, but they wanted to know more about who was running in their cities. They wanted to know who are the candidates, what are their stances. And so one of the things that we're going to be working on is preparing some nonpartisan voter guides in the case that voters at the doors ask us for that. We did have a high rate of folks asking us for that. Some community members explicitly ask you, who should I vote for? Us as 501c3, we cannot tell them that, but certainly we can provide some broad nonpartisan voter guides. I know that the League of Women Voters tends to have some voter guides as well, and other agencies. So it's something that we're going to look into, but it was a lesson learned for us that we're going to implement going into the midterms. Next slide. So now looking ahead at the general midterm strategy that we will engage, certainly we will work with AltaMed in going into the midterms and coordinate with other agencies on the ground. There are a lot of other agencies that are doing this type of work. I think the difficulty in Orange County is that there are a lot of agencies that engage in C4 work and candidate backing work. And that's where we have to be careful, and we can't really have those conversations. So we have to figure out a better coordination role, if you will, with other agencies that are engaging in Orange County. But these are our three approaches or three strategies that we'll be doing. Voter engagement, so nonpartisan guides, and social media on how-to videos, including TikToks. We've noticed that if we want to reach the younger population, TikToks tends to be the great place to do it. We can do some very simple, very fast how-to videos there. We want to re-engage in the candidate forums. So we're focusing and eyeing on the Orange County Board District 2 race, also the city of Santa Ana and Anaheim council races, and possibly some school board races as well, to be able to bring the candidates directly to the community and have the community engage and ask direct questions to the candidates. And lastly, our door-to-door effort, in terms of part of our GeoTV campaign. The last campaign, we only had 4 canvassers over a 2-week span. This time around, we want to have 10 canvassers over a 4-week span. Next slide. So just, happy to connect with you at OCCORD.org, my email, eflores@OCCORD, and info@OCCORD.org. So thank you so much, Lisette and AltaMed and the rest of the partners for allowing us to join today.
Thank you so much, Ellie. And it's always a pleasure to work with OCCORD. We'll be working with them again in Orange County for the general election. And again, our apologies for going a bit over. We have a wealth of information, but again, we will be providing the recording and the PowerPoint deck to folks so that you have this available as you plan for the general election, or as you want to get involved with some of the work that we'll be doing in November. Next slide. Just wanted to share quickly, and we can go to the next slide, where you can get additional resources, at least for our My Vote, My Health work. If you go to myvotemyhealth.org or mivotomisalud.org, You all can find tons of resources and information. Right now, we're currently updating all of our informational side to include information around specifically the general election, but folks can check their registration status. You can check your nearest voting location. But if you go to the Join Us link, you can actually download a lot of the tools that we're developing for the election. You can download the design for this shirt. You can download the design for a vote plan and use them freely. We've really made these available for community health centers across the state to use them, to plug in their logos. We have hold messages that we're going to be using at AltaMed when patients call and they're placed on hold. They can learn a little bit about the elections that are coming up. The MP3 file is up there. And so again, please feel free to use the resources that we have available. Next slide. And with that, here's our contact information. We encourage those of you who, if you're looking to potentially do some work around civic engagement, don't know where to get started, but definitely have some folks who want to get involved, please feel free to contact us. We'll either put you in contact with some of our folks who will be doing field, or we'll put you in contact with some of the partners that you heard from today. But definitely do get involved. It's going to be a very important election, and it is going to be the stepping stone, as you heard from my colleague Vanessa and others, for the 2024 presidential election. Very, very important. It's really important that we engage our community members, our neighbors, our families, and everyone, and encourage them to get out to vote this midterm election. It really is our opportunity to create power in our communities. So with that, thank you all for joining us. A huge thank you for our speakers for bearing with us and being patient with our technology. And we hope to be working with you all. And again, we will be sending a recording of this presentation along with the PowerPoint deck. On to November, everyone. Thanks, everyone.